As a child, and having to go to the dentist, um, I went through some rather rough periods with the dentist. The dentist wasn't gentle at all. He was very businesslike, as I remember as a child, and there was an option of using uh, medicine to numb the pain and whatnot. And, however, back then, my parents were struggling, and as a result, could not use or could not afford to pay for that medication, Novocaine in specific. So my dental visits were, for the most part, without any type of relief from pain whatsoever. My last visit to a dentist was a few years ago, and I was assured that I would be perfectly all right. I would have no pain, no gag, because they were going to use a product called nitrous oxide and laughing gas. And I was told that we could even hit your hand with a hammer and you won't feel it, you won't know it. So I tried that, and I never got any relief whatsoever from the nitrous oxide. It did nothing for me, nothing at all. And so when I initially contacted Dr. Pierce's office, and they were assuring me that, look, we have methods that we can use, that you'll be relaxed, we can sedate you, we can do a lot of things so that you'll be fine. I was doubtful. I had some serious doubts, and the anxiety was there. I had the anxiety right up until the moment that I met Dr. Pierce. He was immediately able to put me at ease, from the standpoint that I'd come back for the actual appointment, and he assured me that everything was going to be all right, that I wasn't going to be completely put out, that I would still have my senses about me, but that I was going to be sedated to the point where I didn't have to worry about gag reflux, I didn't have to worry about pain, that it would all be taken care of. And I trusted him. He didn't approach me as, look, I'm the dentist, I know what I'm doing. He was very, very upfront. He laid out all the facts, full explanation of everything that was going to happen. He did it in a manner that was reassuring to me, was reassuring that I was going to be fine, that I wasn't going to have the gag, I wasn't going to have any pain. And he offered two choices and explained the choices to me: either taking a pill and being sedated that way. And he explained to me how that worked and what I would feel, what I wouldn't feel. And then he explained the IV process and how that worked and what would happen during that. And he was very clear to say, it's not like when you went to the surgeon where you were completely out and you woke up and your teeth were gone. You're going to be semi-awake. You're going to know what's going on. And he explained to me, I have to have you that way, so that there are certain procedures where I'm going to have you move your mouth and your jaw. And he said, so I need you in that. He said, but don't worry about it, that you're going to be fine. And he kept on reassuring me that that exactly what was going to happen. And lo and behold, when I got here and he did the actual work on my teeth, that was exactly how he explained it. I thought initially that I wasn't going to like this. When Dr. Pierce first told me that, look, you're not going to be completely out, I had some really anxiety over that, thinking that in the past I've been put out, haven't known anything, didn't know what happened, didn't want to know what happened, and when I wake up and that's it. And so initially I thought, I don't know if I'm going to like this. I don't know if this. I thought when they said sedation that I would be out, and similar to and he was very careful to explain to me, this is nothing like being to the oral surgeon. This is a different type of sedation. He explained why, that I need you at a state where I can give you instructions and you can respond to my instructions. And I understood what he was saying, but I was still thinking to myself, I don't know if I'm going to like this. Having gone through it, I wish I'd have known about this years ago. I wish this was in place years ago. I wouldn't have had the teeth pulled that I had pulled. I wouldn't be talking to Dr. Pierce about coming back to reconstruction and things that, you know, something I never thought I'd do in the past. And now we're talking about reconstructing some of the teeth I've lost and doing it under his techniques and methods of sedation. I would never do this before. I would never consider coming back to a dentist to get routine work done. That just wasn't in my philosophy or anything I would do. That there was, you know, I wouldn't have anything to do with it. This has truly been a remarkable about face from what I had in the past, with the anxiety that I had and the fears and not wanting to come. And now it's completely different. It's completely changed. And so I thought, why not?